So I'm here with Dr. Mark Socinski of the University of Pittsburgh, and he's an expert in non-small cell lung cancer. And I just wanted to get his overall comments on the meeting thus far. You're just coming out of a session on lung cancer as well. How did you find the session?
I thought it was an interesting session. It dealt mostly with earlier stages of lung cancer and small cell lung cancer, as well as a couple of interesting abstracts on molecular classification of squamous cell carcinoma, some interesting data on KRAS. So all in all, I thought it was a good session.
Great. I actually missed your presentation on Saturday, but one of our freelancers did cover it. You had a poster presentation?
Correct.
Would you mind just giving us a general summary of what you presented?
The poster really reported a subgroup analysis of the phase 3 carbosolvent paclitaxel versus carbo-nab-paclitaxel phase 3 trial that was recently published in the Journal of Clinical Oncology. This was an analysis of patients based upon age, either greater than 70 or less than 70. The observation that we had in this trial was that the nab-paclitaxel arm in the elderly population had a significantly increased survival experience, a median survival of 19.9 months with nab-paclitaxel versus 10.4 months with solvent-based paclitaxel. Obviously, this was not an expected finding, but one of interest because a fair portion of our patients are over the age of 70, and this was an encouraging finding. Whether or not it can be replicated, we're planning to do some follow-up studies in the elderly population to see if this is a real observation or just as a misleading observation from this particular subgroup analysis.
Okay, great. So how did you find some of the other presentations in this area? Were there a lot of presentations that corroborated some of the information you presented?
Well, there were not a lot of other elderly presentations with regard to the influence of different types of chemotherapy, and so this was a bit of a standalone observation. We've known for quite some time that the elderly can be a particularly challenging population of patients to treat with metastatic lung cancer. The median age of lung cancer is 70, so half of our patients are over the age of 70. Developing new ways or novel therapies that will give them greater benefit that also at the same time are somewhat less toxic in this population, because obviously the older patients may be more prone to the side effects of chemotherapy, and that's the other observation that was made in our report, was that the elderly patients seem to tolerate the nab-paclitaxel therapy better than solvent-based paclitaxel. So I guess from this subgroup analysis, it's kind of a win-win situation for the older patient because of the better survival benefit, higher response rates, and a toxicity profile that was a bit more favorable. Now, the one thing to be clear to understand about this trial is that the nab-paclitaxel was delivered on a weekly basis, and the solvent-based paclitaxel was delivered on an every 3-week basis. So there was a difference in schedule in the randomization. But again, I think in this day and age, I don't think weekly schedules are really a significant drawback to every 3-week schedules.